Slide. Tanner's model of clinical judgment. Clinical judgment is essential in nursing, guiding decision-making and patient care. Tanner's model breaks this process into 4 key aspects: noticing, interpreting, responding, and reflecting. These steps help nurses analyze situations, take appropriate action, and learn from patient outcomes. The 4 aspects of Tanner's model. Noticing involves gathering data and identifying cues. Interpreting is about analyzing information to determine significance. Responding requires setting priorities and taking action. Reflecting helps nurses evaluate outcomes and improve future care. Together, these steps create a structured approach to clinical judgment. Noticing. Noticing is the first step in clinical judgment. Nurses must recognize important cues in patient data. Experience, theoretical knowledge, and the care environment all influence what is noticed. Missing key details can lead to incomplete assessments and poor decision-making. Interpreting patient data requires critical thinking and experience. Nurses analyze information using different reasoning patterns, analytic, intuitive, or narrative, to make sense of a situation. Expert nurses prioritize data differently, relying on past knowledge to determine the best course of action. Responding. Once data is interpreted, the nurse takes action. Effective responding depends on experience, clinical reasoning, and knowledge of best practices. Interventions are selected based on patient needs, and adjustments may be made as the patient's condition evolves. Reflecting. Reflection is a crucial part of clinical judgment. Nurses evaluate the outcomes of their interventions, considering what worked and what didn't. Reflection in action occurs during care, while reflection on action happens afterward, shaping future decision-making. The National Council of State Boards of Nursing, NCSBN. Clinical judgment is now a key focus of nursing assessment. The NCSBN has developed a model to measure decision-making skills, including recognizing cues, forming hypotheses, and evaluating actions. The next-gen NCLEX integrates these principles to assess nurses' clinical reasoning. Sample question 1. Which stage involves using past experience to make sense of patient data? The correct answer is interpreting. In this stage, nurses analyze and prioritize information, drawing on knowledge to establish the best course of action. Sample question 2. At what stage does the nurse gather data through assessments and observations? The answer is noticing. This phase involves actively collecting cues and relevant patient information to guide decision-making. Sample question 3. Which step focuses on developing and implementing nursing interventions? The correct answer is responding. In this stage, nurses take action based on their understanding of patient needs and clinical judgment. Slide. Sample question 4. Which phase involves evaluating interventions and making necessary adjustments? The answer is evaluating. Nurses assess the effectiveness of their actions and modify care plans to improve patient outcomes. Thank you for joining us. We truly appreciate your time and engagement. We'll see you again soon with another exciting topic. If you enjoyed this content, don't forget to subscribe, like, and share to support the channel and stay updated with our latest discussions. Until next time, take care and stay informed.